Hi, I'm Anderson Dos Santos, the owner of Oceanview Building Group, and I'm here today with Dr. Jared Helfant from Blue Dental in Miami Shores. Jared, who is Jared, and how can we tell everyone what do you do, where you came from, where you grew up, and how we can let you know your story?
So my name is Jared Helfant. I practice here in Miami Shores at my new office, Blue Dental, which Anderson built. So I grew up in New York City until I was about 15 years old. We moved to Florida in Boca Raton. I went to undergrad at the University of Florida, go Gators. Then I moved back to New York for NYU Dental School, which I was there for the 4 years. And then after I came down to Miami, which I've been practicing here ever since for about 15 years.
That's awesome. That's awesome. So before we get into it, I have a question. What is the number one myth that we always hear from patients that came walk into your office, say, "Hey, I haven't been to the dentist for this reason, or I have bad teeth for this reason"? What's the number one myth that we can let everyone know?
I think that people kind of take longer than they should to come to the dentist, mostly out of fear, out of not understanding. There's always, when people think of a dentistry, they think of pain or, you know, people, they're fearful or they go in, they don't know what to expect. And, you know, that was one of the reasons why I built this office in the design it's in and how we talk to the patients, how we treat the patients is to kind of mitigate that fears. And, from a building standpoint, which is what you do, I think when someone goes into anywhere, a dental office, a medical office, a restaurant, the first thing they see is how it looks, right? And when you see something, visual appearance of something increases or decreases anxiety. So when we built this, the first thing we wanted to walk someone in to an office, to a reception area that felt comforting, inviting, and that's their first impression of the office. So that was very important to us. And then obviously everything we do thereafter is going to be to help a patient in a way if they do have anxiety to mitigate that, and we can get into that later.
Awesome. So you really think that nowadays in industry, the appearance of your office makes a difference and how patients feel comfortable, and just give them that confidence that you're going to be able to.
Absolutely. I mean, when you walk into anywhere, the first thing you're doing is you're looking around. Is the place nice? Is the place clean? I mean, I've got into doctors' offices. I got into restaurants. I've got into, a chiropractor's office. And I'm just like, yeah, this is a little dirty. And I'm already like, do I want to be here? So I start out negative. And, what we want to do in any business is we want them to walk in and start with a positive. And instead of trying to build that trust, you basically want to lose it. You want them to come in already with a good feeling. And that's with anybody, first appearance. Just like when you meet somebody, how someone's dressed, how someone looks, are they smiling, their teeth, it's all first appearance. And then you win it or lose it from there.
Yeah, that's really true. I mean, and that's what we try to do in our business as well. From a building standpoint, we always look at what difference are we making on a patient side too as well, because we don't just come and build walls, we don't want to just put something together because the whole point of a building office is to make sure that the patient is having a complete different experience, from the past, which was very typical, old, very square, very unpleasant. So the goal is nowadays is to make it as welcoming as possible. So then the doctor on your side can combine the experience, that you provide and to make a patient come back and say, okay, this is what I want it to be, what I wanted, to have in my smile. Now, the other question that we have, which I know it's in the industry, is the number one topic: veneers. I know there's always there's that side where, okay, does it really ruin your teeth? Is it really something or is that just a myth?
So the problem with veneers is that they're not always done properly. When veneers are done properly, in most cases, you really have to minimally prep the teeth, hardly shave the teeth down, or sometimes not shave the teeth down at all. And that also depends on your teeth. If you have very bulky teeth or one sticking out, you might have to shave it back more. But for the most part, if your teeth are in line, and if they're not in line, we can do some kind of orthodontics first, like Invisalign, put your teeth in line. And then if they are, really, we should be shaving the teeth down minimally. Veneer should be placed on enamel, which is your outer protective layer. You shouldn't be shaving the teeth past that enamel. So no, but at the same point, you are shaving your teeth down a little. So it's not like if you could take the veneers off and, go back to your natural teeth. In most cases, unless you're doing no prep veneers, which not everyone's a candidate for, but some people are.
So that's something when you look at a patient, that's something you have to look at and analyze based on, I'm sure shape, featured, size, shape of things. You look at all those things, right? As
Yeah.
a creative custom
Well,
design.
the first thing we're doing is we're taking, high quality pictures. We have a ray face machine where we take a 3-dimensional scan of their whole head, and then we're gonna digitally design their teeth, using the X-rays, using the pictures, using the ray face, using the scan of their mouth, an intraoral digital scan, and we're gonna design their teeth.
So veneers is not that bad thing, that because we see on both sides, or a patient that went to on the other side of the country.
The problem is, especially in Miami, is not all veneers are created equal. There's a lot of poor quality veneers out there. In Miami, probably more than anywhere, unfortunately. But we've seen a lot of cases where we had to redo veneers. From the, it's not just the look of them, where you get these very opaque, chiclet-looking teeth, but it's also the margins. If your margins of your veneers aren't perfectly flat and against the margin of your teeth, or the gum line of your tooth, you're going to start getting bacteria build up there, and your gums will start getting red and bleeding. So it's very important of how the veneers are made, that they're made exactly, fitting your teeth exactly, and there's no what's called open margins, that everything's closed and sealed perfectly. But if veneers are done properly, they should last many, many years and should have no issue. The problem is, there's a lot. I mean, we see articles in newspapers, some veneer clinic, the guy's not even a dentist, right, and they're doing veneers, and people unfortunately see that, and they say, oh, well, look, I can get veneers for this price, but they're not all created equal. If you're getting something really cheap in life, you get what you pay for. And,
exactly.
That's usually how it goes.
Yeah. So for someone who's looking to have a celebrity smile, what's the number one thing that they should look at first before just going ahead? Let's just put veneers all over my mouth. What's the number one thing that should?
Well, first of all, whenever a patient comes, what I first like to ask them is, what are their goals? Because when somebody says, I want this smile or that smile, sometimes they're not exactly understanding. So the first thing we talk about is what their goals, what that means to them, what they're exactly looking for. And sometimes veneers aren't the answer. Sometimes it's their teeth are just crooked, and you can do Invisalign and put them back into place, and they're perfectly happy. Sometimes they just want the shapes of their front teeth to be a little different, but not necessarily shave anything down. And we could do what's called composite veneers, where we make veneers out of composite, which is like a filling material. And that you don't have to shave your teeth down, you don't even have to get numb, and we could recreate the look of your teeth in the same one day. And a lot of patients, are loving those. And if they're done right, they almost look like porcelain. I mean, it's incredible what we can do with high quality composites now. So I think we have to understand first what the patient's looking for. And I have a saying I always say is that we're not treating the teeth, we're treating the person. And that person comes with all kinds of medical constraints, financial constraints, beliefs. And as dentists, we have to get away from figuring out what's best for that tooth, but what's best for that person.
That's awesome. And I think that's a great way to explain as well, because every patient I'm sure every case is different. There's no one size fits all. It's different. So that's a great way to put it. So what's the other question is what's the one thing that we do it every day, but we ruin our teeth? Like, what, maybe a drink or a food that we should be avoiding?
Well, I mean, listen, I'm also into health and wellness, but there's a lot we should be avoiding or not, unfortunately. But for tooth-wise, I think the worst things are obviously sugar and acids. So, sugars that stick to your teeth, that is what's going to create, tooth decay and periodontal issues and so forth, as well as acids. When you're drinking, a lot of, people with lemon water twice a day, that the acidity of the lemon or the orange stays on your teeth. But I think the most important thing is, if you are eating sugars and acids, is brushing your teeth after. And if you can't do that, at the very least, rinsing with water after. We don't want to leave the sugars or leave the acids, stuck to our teeth. We want to get them off, as best we can after we utilize those, because it's unrealistic to say, quit everything.
Right. Yeah, which, I mean, as I guess the best way to do it is just avoid as much as we can on a daily basis, so we don't have an issue later, which then goes back to avoiding the dentist because of pain. Now it's a much bigger issue later. Right. It's just like in construction, as if there's a problem, you want to address it as soon as possible. So then if you just keep avoiding, later on, it's actually going to become a much bigger problem.
And most people, after they come, they say, my fear was all mental. Did you have pain? No. Dentistry is not painful. We numb you up now, and even the ways we're getting you numb are very pain free. It's more in here than it really is, the actual pain that people are in fear of.
Yeah, I believe that's what it is. We put ourselves in a way where we recreate these stories, and then we believe in ourselves. We spend all our lives, just really believing it's real, and that it keeps us from going and doing the right thing. So, and in the dental space, you guys dominate that. You guys, are doing a very good job with the high techs. I mean, the equipment that we installed in SR, which was very excited about, state of the art equipment, and of course, these are necessary tools that's going to help you advance into what the dentistry is going. What have you seen change from dentistry in the past to dentistry now?
I think that the two biggest things in the last few years has been AI and digital dentistry in general. So when we take x-rays, we have an AI program that's integrated in. So the AI program is actually reading our x-rays. It's looking for cavities. It's looking for bone loss, open margins on crowns, so we have that, and it's actually a first line of defense, in the sense of it's not 100% right, but it shows us, and it also creates trust with the patient. It's not just us telling them it is. We actually have an AI program, reading what's going on. It's very color coded, and it's easy for the patient to see. And then the second thing is digital dentistry. With the machines we have in the office, we can make crowns same day with the 3D printers. We could design cases, print full mouth teeth, full. A lot of things same day, night guard same day. The things you can do with digital dentistry is great. Designing teeth, rapidly, and then the AI and digital dentistry are integrating together. And I think obviously the AI is going to get better and better over time. But that whole AI digital dentistry combo is, I think, going to be the forefront of practices, and make patients be able to get what they need, more accurately and quicker.
That's awesome. So you guys see the use now and the future of AI integrated into the office.
Except for veneers. And interestingly, is the best veneers, the most natural looking veneers, are still hand layered porcelain. Our lab tech who's brilliant, who's just hand layering porcelain, and that's always going to give the most natural look.
So AI, in other words, will not replace a tech in the lab that's going to be hand doing it. That's going to be the best results.
No, not yet. Still the best results, in porcelain are from these lab techs, hand layering for veneers specifically.
That's awesome. I think, at Dr. Jarvis, what he's doing is breaking down all these myths that that there are there, that we hear, bad things, these things. So it's all stories until someone like a professional like him in his industry, just breaking down the real, the real things that behind the scenes that has happened in order to have a beautiful smile. So, I have a question for you. If you could tell your 20-year-old self, Jared, back then, what dental tip would you give him at that time? What would be something you motivate, say, hey, in all years of life, what would be something you tell him?
Hey, educate yourself, after you're practicing, and tons of CE, keep learning, and be confident and be empathetic with patients. I probably would have told myself to build something like this 10 years earlier though, but that's really what I would say is, empathy and listening to patients goes a long way. As dentists, we get in our heads and we think we know best, and we're not listening. And I think, and that comes down to, we're not treating the teeth, we're treating the patients.
Awesome. Now, the other question I have is, it was a great experience building this office, with you and the whole team, just, putting together this beautiful office and really create a change of experience for the patient. Because at the end of the day, our goal for us and for you is to make sure the patient is taken care of. And how was that experience working with us throughout this process in the construction?
Well, first, going into construction, whether you're building a house or building a business, is scary because you hear all the horror stories, all the problems with contractors. I've had friends with contractors, they couldn't, they make a call and they get a call back 3 weeks later. So for me, I think the number one thing that I most appreciated working with you was, it was communication. I mean, we literally talked every day. So to me, that was number one. No matter what roadblocks we hit, there was constant communication. And I think number two was, was going above and beyond from the permitting process. Unfortunately, Miami, we had snafus with, derm and things that were just out of our control. But, you literally were driving from Boca to Miami 4 times a week, and, I think without that, we could have been held up another 4 months. So, I was very appreciative of that. And to be honest, that was above and beyond of what I was actually paying you for. So, that was very appreciative. So yeah, I think those two things, listen, with anything you're building, anything you do in life, there's always going to be problems. And I think the sign of working with someone well in any business is not if problems arrive, it's how the problems are handled. And, that was what I felt most is no matter what was going on, if anything arose, you took care of it yourself personally. And we talked every day about it. So
We did. Yeah. It was awesome. It was
and
definitely-
I also did change the whole look of this office,
It was true.
4 months into the project.
Right,
so
right.
we totally created a totally new concept.
Yep,
So
yep.
you kind of went with that and, it worked out, beautifully.
Awesome. Well, it's because, at the end of the day, what we want to hear is the clients are happy today. So, and always tell clients, if you have a crazy idea, let's put it on the table now. Let's do it now because it's going to take some shifting, some changing around, but it's doable. It's not
Right.
impossible. So, but at the end of the day, we want to be able to, okay, once we're done, the client's happy, and it just really is just that feeling of just, we're proud, proud moment of that. Something we built, it's something we don't look at just construction. We look at how did we, take care of this client at the end of the day. So, well, Jared, thank you for your time today.
No problem. Thank you.
I'm sure we're going to be having a little more time, in the future soon. I'm going to do more of, so we can share with the public, more of the dentistry and construction.
I'll close out saying one thing is that, we are going to be building more blue offices. Anderson will be doing for us. And I would 100% recommend him. Not just because of the quality of the work, but like I said, more than anything, just, the constant communication and just how devoted and dedicated he was to the project and, made sure everything went well 100% of the time.
Awesome. All right, Jared. Thank you.
No problem.